Hi everyone, I'm Amy, and in today's video, I'm going to share 5 practical and proven tips to help you maximize the effectiveness of Tadalafil in treating erectile dysfunction. Erectile dysfunction is far more common than most people think. Studies show that about 10% of men under 40 will experience some degree of ED, and that number jumps to 30–50% for men between the ages of 40 and 70. One of the primary treatments available today includes phosphodiesterase type 5 inhibitors, such as Tadalafil and sildenafil. These medications act as vasodilators. They work by improving blood flow to the penis, resulting in better firmness and rigidity during sexual activity. However, it's also not uncommon for patients to report that Tadalafil seems to have lost its effect over time, or isn't working as well as it used to. If that sounds familiar to you, don't worry. In this video, I'll walk you through 5 essential strategies that can help restore and even enhance the drug's performance so you can get the results you're looking for with greater consistency. Often patients take it incorrectly or need to adjust some aspect of how they use the medication. I will now share 5 tips that you can adapt to using this medication. Here we will primarily focus on on-demand medication, which is used only on the day of sexual activity. The first tip is to purchase quality medication. A very common question is whether generic and brand name medication have the same effect. It's important to understand that quality can vary. It is important to use medication that is trustworthy. If the generic manufacturer is trustworthy, and if you have used it before, and believe in the effectiveness of the substance, then it's okay to use it. However, when using medications that have such an immediate effect for evaluation, it is very important that the medication is of high quality. For example, urologists often recommend ZAD or Cialis to patients. They have no ties to the industry, but know they are reliable medications. Tadalafil is sold in 2 dosage strengths, 20 and 5 milligrams. The 20 milligram dose is intended for use only on the day of sexual activity. This medication in the 20 milligram strength does indeed have a more potent effect. It can last up to 36 hours in the bloodstream depending on the quality of the medication and its absorption in the patient's bloodstream. The second tip is to try taking the medication on an empty stomach. Many patients associate Tadalafil use with, for example, alcohol intake, or even the consumption of copious high-fat meals. Both alcohol and meal consumption are associated with reduced absorption of this medication in the gastrointestinal tract. Therefore, this can decrease the medication's effect. So, if you are experiencing this type of issue, if you feel the medication is no longer effective, try using it on an empty stomach. The third tip is to seek sexual stimulation along with taking the medication. And here we emphasize to patients that it's not just about taking the medication an hour before sexual activity. The patient cannot take the medication and go to sleep, read a book, or watch a soccer game. They necessarily need to generate stimulation for the erection cascade to be triggered. Sexual stimulation begins in the brain. It is neurological. So the patient necessarily needs the sensory stimulation, whether it's touch, smell, feel, whatever they find best. The fact is they need to take the medication and seek excitatory stimulation. Fourth tip, using the correct dose of the medication. And here when we talk about 5 phosphodiesterase inhibitors, we have Tadalafil and sildenafil. The 20 milligrams dose of Tadalafil is the dose for use before sexual activity. Many patients think the 5 milligrams dose has the same effect. The 5 milligram dose is for treatment. It is for daily use regardless of whether the patient intends to have sexual activity. Therefore, this 20 milligram dose is the most indicated for maximum effect. Furthermore, sildenafil, which is the popular little blue pill Viagra, is available in 25, 50, and 100 milligram formulations. Each patient needs to adapt the dose used to their individual situation so that the desired effect of the medication is achieved. Fifth and final tip, the time between taking the medication and desired sexual activity. Often patients use the medication 30 to 60 minutes before sexual activity. A tip here is to try using it 1 to 2 hours before sexual activity. Tadalafil, as I mentioned, works for up to 36 hours. It maintains this vasodilatory effect for up to 36 hours. However, we know that its peak effect is within the first 10 hours. So aim to use the medication at least 2 hours before your sexual activity and use it primarily within this window to benefit from the maximum effect. After the first 10 hours, it is more easily cleared from the bloodstream. And listen, before we finish, there's something important. If even after following all these tips, you still feel that the medication's effect isn't the same as before, or that you're lacking that extra boost when needed, there is a 100% natural alternative that has been drawing the attention of specialists worldwide. A simple 7-second ritual done at home that has been helping thousands of men restore their potency, confidence, and desire without needing to rely solely on pills. If you want to learn more, just point your phone's camera at the QR code on the screen or click the pinned link here in the comments. This video could be taken down at any moment, so act now and watch while it's still available. If you found the content of this video interesting, if you think it will help someone you know, please share this information. Don't forget to subscribe to our channel and activate notifications to stay updated on our weekly content. Best regards, and see you soon.